Good evening, and we're back for another week of Corona Conversations in the Black and Brown community. And tonight we have a wonderful show ahead of us in which we're touching on a topic that we also touched on last year, and that's the fact that not hashtag Black Trans Lives Matter, but of course all trans lives matter. But unfortunately, we've lost a disproportionate number of Black trans females in this country. But we are here to highlight the contributions as well as the work of our LGBTQ plus community. As usual, you have myself as well as Dr. Maya Williams as the host of the show. So we just would like to also highlight that November 20th is the Transgender Day of Remembrance. And that was started back in 1999 by advocate Gwendolyn Ann Smith to honor the loss of Rita Hester, a transgendered woman who was unfortunately murdered in 1998. So let's not forget her and her memory and the many others that we've lost over the years. And of course, our co-moderators are myself, Dr. Allison Myers and Dr. Maya Williams. And as of 2 days ago, we see that we have a total of almost 50 million cases of COVID here in the United States. And unfortunately, we've lost almost 750,000 Americans. In terms of vaccines, we're doing better. They've delivered over 500 million vaccines and a total of 221,961,370 people are fully vaccinated here in the US. And we also have a good number of people who are getting their booster dose. So now to talk about the topic at hand, our partnership with the LGBTQ plus community. So when we think about the LGBT community, I remember in high school, we had a 10% club because at that time, 10% of the population identified themselves as members of, at that time where it was just lesbian, gay, and bisexual pretty much. And then it expanded into including transgender, queer, intersex, as well as asexual. But for me growing up, it was usually just LGBT community, LGB community, and then it started to grow and expand. So even for me, I had to continue to remember that it's more than just lesbian, gay, and bisexual. The population has grown. In 2020, it was increased to 5.6%, up from 4.5 in 2017. 1 in 6 Gen Zers, those are people who last year were aged 18 to 23, identify as members of the community, most of which are bisexual, followed by gay, lesbian, and transgender. And roughly 3.3% of people identify as non-heterosexual, but not of any of the categories. We've seen terms such as pansexual come out, so that might be also part of what these remaining folks will identify as. And we know that internationally, even nationally here in America, gay rights has varied. Here in America, depending on where you live, you may have much more gay-friendly communities, especially in places like the Northeast compared to the South. And of course, overseas, you may have even more unfortunate discrimination against gay people. We find that in Western Europe and in America, you have more gay-friendly areas, whereas places such as the Middle East, Eastern Europe, Russia, Ukraine, Caribbean, and Africa tend to be a little bit more homophobic and have some antiquated laws, such as British old traditional way, so-called buggery and gross indecency, in which people who are of the same sex were not allowed to have relationships, even if they were consensual. We also know that just like people of different races, gender, people who are of the LGBT community also experience a large amount of racism. A lot of transphobia or homophobia as well. So they deal with discrimination every day. More than 1 in 3 persons who are members of the LGBTQ plus community have faced discrimination in the past year. Nearly 1 in 10 LGBTQ positive people in the US have experienced workplace discrimination in the past year. And a study at UCLA showed that roughly 46% of people in the LGBT plus community have experienced workplace discrimination. And that can vary in terms of what that can be. So we know that sometimes it can be a matter of hiring and firing issues. We know that wages can be an issue, as well as benefits. For a while, people in the LGBT community had to fight for partner benefits where they were only being given to people who were married or people of opposite sex. But over time, thanks to work with the people like Harvey Milk and a lot of other people who fought for gay rights, allies, there has been a movement where people can actually share benefits if they are in same-sex relationships and can get married. We know that amongst our transgender community, unfortunately, sex work has been used a lot in order for people to make money. And unfortunately, because of the high amount of discrimination in the workplace, people who are members of the transgender community are 3 times more likely to engage in sex work. And unfortunately, the reason why I say that it's unfortunate is because of the fact that in America, sex work is usually shunned. It's not something that people look down. This is something that people often look down upon as opposed to something that people embrace. They don't think that it's hard work. So that's why it unfortunately has such a negative connotation. But the other issue about sex work is that unfortunately, it contributes to the high rates of disproportionate number of HIV in the transgender community. So roughly 20% within the world and in America of our transgendered community that are women are living with HIV. And 1 in 3 transgender people in DC alone are HIV positive. And unfortunately, PrEP, which we often use and we'll hear about more to help with HIV prevention, is not really was not really being promoted and used amongst the transgendered community. So hopefully we can get the word out. And as seen in heterosexual women, same as with transgender women, there's a disproportionate number of us who are Black and Latina who have HIV cases. So this is something that we should not be silent about. And unfortunately, there's a connotation for women who are doing this sex work that it's called walking while trans, which is obviously derogatory. And of course, as mentioned earlier, the big part of what's shaking up the transgender community as well is not just the rates of HIV, but also the rates of violence. And unfortunately, last year's show, we had someone who lost a friend to transgender violence here in Harlem. And actually, one of my medical assistants lost her nephew to transgender violence in Texas not too long ago. And it's really hard for families to have to deal with these trials because they get dragged out for a long period of time. And very often the killers are not even found, which is even worse. And these 2 cases, the murderers were found and have been brought to justice. But for so many of these trans women that are killed, their murderers are never found. And that's what makes this so unfortunate, because we recently saw what happened with Jenny Prito, where the news went so hard for her and finding her. And of course, I'm not saying that she should not have been found, but you don't see that same level of effort for women of color, whether they're cisgender or transgender. So the media definitely needs to do a better job of putting out this information when we're losing all of these women of color. And this is what we call the missing white woman syndrome. We also have to consider the fact that within the LGBT community, we have the concept of intersectionality, which was started by Professor Crenshaw, a lawyer at UCLA. So, for people who are members of the community, but also members of non-dominant religion, of other ethnic groups, they have more burden of living in the community because they're often their other communities are shunning them. So they have an extra burden of intersectionality, being a Black queer man, being a Muslim transgendered woman, being a Latina transgendered woman. So it's a much different fight for all these people who are coming from these other communities and not simply the dominant community here in the United States. And we know that unfortunately, mental health, is a big problem, not only for most of us here with the pandemic, but for our people who live in the LGBTQ community, because there's so much stigma attached, whether it be family shunning people for being a part of the community, the violence that may be existing in the community. There's definitely an increase of substance abuse, mental illness in terms of mood disorders and anxiety that need to be discussed. And also part of the problem too is we need to have enough providers that can provide care to people of the LGBT community, whether it be physical care or mental health care. So we would be remiss without saying thank you to people, especially Jared Oliveira. He helped us so much with putting this show together. So we owe him a big round of applause and thank you. Also, of course, Mr. Richard La Rochelle, Mr. Krishna Jesse Mitchell, Mr. Courtney Tyson, our day one audience members. Please, if you don't already follow us on Twitter at Minority Health 3 or on Instagram at Minority Health Combos. So now for our wonderful esteemed panel tonight, we have first Mr. Amin Flood, who is a technical officer in the Ministry of Tourism for the government of St. Lucia, where I wish I was right now because the weather is better than it is here in New York, where it is currently 48 degrees. And Mr. Amin, please do not tell us how warm it is in St. Lucia. We don't want to hear it. He's a former talk show host, dancer, and actor, and he volunteers with the Eastern Caribbean Alliance for Diversity and Equality, and he's done some wonderful work for doing some pride work down there in St. Lucia, so we are very happy to have you. As we are happy to have Senora Boyana Garcia, who is a transgendered organizer here in the community. She's a local for me because she's in Jackson Heights doing wonderful things. She's the organizer for the largest annual March for Transgender Latinas here in Jackson Heights. It's called the Trans Latina March. She has a powerful story of escaping from Mexico at the age of 15 to come to the US and has endured so much. So we are very happy to have you, Senora. And of course, we have also Dr. Christopher Awad, who is an Associate Director of Hospital Medicine, as well as the Program Director for the Transitional Year Residency Program at Plainview Hospital. So he was groomed here at Northwell because he actually trained, he's one of ours. And he also is a big part of the LGBTQ medicine track for family medicine. And last but not least, we have Mr. Larry Martinez coming to us all the way from Portland, Oregon, where he still has light, so we're a little jealous of you, Larry. He's an associate professor and associate chair in the Department of Psychology. He has his PhD in industrial and organizational psychology and has done focus work on discrimination around the LGBTQ community. So now I'll turn it over to my esteemed co-host, Dr. Maya Williams, who was recently just accepted for a wonderful fellowship. I'm so proud of you.
Thank you, Dr. Martin. Thank you, Dr. Myers. I had issues unmuting. So the first question I'd like to ask to Mr. Flood, a 2018 Human Rights Watch report titled, "I Have to Leave to Be Me, Discriminatory Laws Against the LGBTQ People in the Eastern Caribbean," documented discrimination, violence, stigma, and prejudice against LGBTQ plus people in the Eastern Caribbean. And the Caribbean is the only region in the Americas with nations that criminalize consensual same-sex relationship. Can you tell us what it's like living in the Caribbean as a gay man, a place where buggery and cross indecency laws are still practiced even in 2021?
Well, first of all, thanks for having me. Appreciate being here. The Caribbean region is still extremely homophobic. People, members of the queer community in St. Lucia are still ostracized by family. Discrimination is very covert, especially with work. And daily you hear reports of violence, murder against members of the community. In the Caribbean, gay rights is not seen as human rights. The buggery law, although we've done much research and asking around, we have not seen or known of any real life application of that law. However, though, a lot has to be said. It speaks of confidence when governments in the region are either unable to or unwilling to repeal or even speak in opposition publicly of repealing that law. It's again, the region is very rife with vile contempt towards the community, and all you have to do is read the comments on a news article that addresses a gay issue.
Thank you, Mr. Flood. The next question is for Ms. Garcia. There are 1.4 million adults identifying as transgender in the US. Can you explain the term transgender and tell us some more about your story?
Sure. Well, thank you for inviting me. My name is Diana Garcia. I'm a transgender woman I immigrated to the United States when I was 15, escaping transphobia back in my country. And it was very difficult for me to, come into a new country, not speaking the language, and also being who I want to be, because once I decided to start taking hormones, my body was changing and everything was changing. And that's how the discrimination started, right? So I have the dream of living in New York City, because I heard New York City, it's so progressive. New York City, it's the most wonderful place for transgender women. But the reality is that if you are trans and you are transgender or a person of color, there is a lot of barriers here in New York City, especially when we talk about this employment. If you consider yourself as a transgender, they not give you an employment. And that's why many of my transgender sisters end up doing sex work, because after taking hormones and doing my I was working in a restaurant. I have a lot of experience working in a restaurant, but after 6 months of taking hormones, the owner of the restaurant told me, "You're not welcome here anymore. There is no more job for you." And I was like, why? If people love me, he doesn't explain me why, but he just fired me. I decided to, continue knocking doors to try to find another job, but it was super hard. And that's why after 3 months of knocking on doors on different places to find another job, I end up doing sex work. And that is why many of the transgender people are doing sex work. And I know that it's very difficult for transgender women's doing sex work, and especially harassment against transgender people from the police. Because for the police, if you are trans, that means you are doing sex work, because that's a fine that they give you. I know that those Dr. Mayers mentioned about the access to condoms. So basically in New York City, 2013, if you are a transgender person and if you are walking down the street and the police stop you and find you condoms on you, that was enough evidence for them to arrest you and charge you with a charge of prostitution, even if you are doing sex work or not. That was my case. I was walking with my boyfriend in a night in 2008, and I was arrested just for carrying condoms, because they assumed I was doing sex work. Even I tried to explain them that I wasn't doing sex work, that the person walking next to me was my boyfriend. They arrested me. And it wasn't not the only time that I was arrested, but also that's why we decided to push or to have the access to condoms campaign, and we passed in 2013. After that, as Metro New York and as a coalition, the Criminal Coalition, we also pushed to decriminalize sex work and also the working while trans. So the working while trans, it's a penal code that criminalized transgender people for 44 years, only for walking or for expressing yourself. And now we repealed that law. And our goal is to decriminalize sex work, because we know that only this year, 44 transgender people, people of color, were killed in the United States. I know it's so sad, but also many of those people that lose their lives, they not get justice, because one, they are people of color. Two, they are sex workers, and if they are sex workers, people don't, like, the police doesn't care. They don't focus on them. And that's how we have an increase of violence in the United States. And I know that many transgender people suffer so much during COVID-19 because one, we don't have no job, and we only depend on sex work. And so many transgender people were saying, I don't want to like do sex work right now because I'm afraid of, you know, being with a person that has COVID. And it was very difficult for undocumented trans sex workers during COVID-19, and we still having problems, economic problems. But yeah, I want to also thank you all for being here, for providing services for my community, for listening the testimonies of people, and for supporting my community. Because for many years, nobody listened to us. Nobody had this type of conversation. And I'm so happy that we are having this conversation, right? So I also want to invite every person that lives here in New York City to support our Trans Day of Remembrance that will be happening on Saturday, November 20. At Corona Plaza, 6 p.m., 7 train to 103rd Street. An increase of violence was happening in 2016. So from 2016 to now, we have more than 31 cases of hate attack against transgender people. And most of this, most of our members or transgender members doesn't go to the police because they are afraid of being la burla, or because I went to the local precincts with many of my sisters, and they just laugh at us. The only question they say, okay, so what you was doing outside? What do you like? It's not your business. Do your work. And also, they don't provide interpretation for transgender people. And when we go there and they say, okay, we don't speak your language, so come back another day. That is not okay, because they are there to support our communities, even if the person is a person of color, or if the person doesn't speak the language, they are there to help. But thank you so much for having me. I'm a proud trans and also former sex worker. And if I lose my job one day, maybe I'm gonna continue doing sex work, because sex work is work, and many people have to understand that transgender people survive doing sex work, and sometimes it's the only way to survive in this country. Thank you.
You're welcome. Thank you for sharing your story. And in talking about sex work, according to the article, this question is for Dr. Awad. According to article, trans women don't want your sympathy. They want to be treated as human beings, by Alicia Gaza in Marie Claire. Black cisgender women have a life expectancy of 78 years, while a Black transgendered woman is only 45 years. What are some of the contributing factors for this grave disparity?
Hi, thank you for having me. I appreciate the opportunity to chat with everybody tonight. So, I mean, I think that unfortunately what we see specifically in Black and Brown transgender women is a layering of every single prejudice. So we see transphobia, we see racism, we see classism, we see even misogyny, right? So a lot of homophobia, I believe, is rooted in misogyny. So all these get sort of compounded on top of one another, and just provide for this really toxic situation. So trans women of color are particularly at risk for the police harassment, for incarceration at increased levels, mistreatment when incarcerated. Intimate partner violence is a big issue, likely tied up in some homophobia.
the job discrimination is a huge issue. Just the low socioeconomic status because of that prejudice in their inability to obtain employment. Access to care is a huge issue as well. In New York, we're fairly fortunate that access to healthcare is pretty readily available. Transgender folks are able to get insurance, but in many places, that's not the case. And really, there is a huge struggle to get access to care. So, also an incredible amount of distrust against the medical community, rightfully so, because there's been so many issues historically with getting adequate care. The transgender community is one of the only communities, or probably the only community I can think of, that ever goes to the doctor and needs to explain to the doctor how to take care of them. And this is something that we've viewed for so long as acceptable. And to me, it's completely unacceptable. People come to doctors to be taken care of, and we should be competent and able to do that. So I think, it's, from the medical standpoint, just a huge system failure on our part in taking care of trans folks and keeping them healthy, engaging them in care, giving them a safe place to seek care, training doctors and other care providers to be competent and to provide quality care, and sort of overcome those boundaries to people getting the care that they need.
Thank you very much for that response. And this question is for Dr. Martinez. We've been hearing a lot about job discrimination and sex work, and we have this whole field called IO psychology that not many people know about. So could you tell us what is an IO psychologist, the role of the IO psychologist, and how important and instrumental IO psychologist is in helping us deal with job discrimination and transgender or LGBT issues at work?
Sure. So IO psychology stands for industrial organizational psychology, which is just basically using psychological principles and theories and research and findings to inform workplaces. So it's there's kind of this duality, right, between doing what's best for employees and doing what's best for the organization. And a lot of times those aren't always the same thing, right? So you kind of have some people who focus more on organizational benefit and some people who focus more on employee benefit. As a field, we're interested in things like how to select employees, how to train employees, how to recruit employees, how to motivate employees, how to keep employees happy and safe and satisfied and engaged in their work. And also, on the more employee side of things, there's an emergence of an emphasis on work-family balance and safety and on diversity and inclusion. And that's the umbrella that I kind of fall under, is diversity and inclusion. So a lot of the work that I've done is on providing voice and understanding the experiences of employees that are generally not represented in traditional science, right? So we've done lots of different stigmatized identities and characteristics at work, and now focusing a little bit more on allyship. So as a field, IO psychology is kind of like the scientific understanding of how HR policies might work, right? So it's like, how do we implement this? And it's the science that goes behind that. So that's kind of, it's chiefly important in terms of not just organizational functioning, but also keeping employees safe and happy and productive and all of the things that, we hope to do. If it's okay, I wanted to mention something that has been a running theme in what both Amin and Vianney mentioned, is the importance of laws, right? So the legal framework is really, really important. And one of the things that we found in terms of discrimination is that if you do the same type of study, so the lab that I was trained in, my advisor's work, Dr. Mickey Hebel at Rice University, she's done a lot of field studies where we'll send people to do job applications and to apply for jobs, real jobs with real managers in real malls, and then tracking their callback rates and placement rates. And in some cases, they're stigmatized in some way, and in other cases, they're not, right? That's the kind of candid camera way that we implement the research. And what we found is that for LGBT or gay and lesbian employees in particular, if you do the same study in a city that is that has local sort of municipal laws that protect against employment discrimination based on sexual orientation, and then you do the same thing in other cities that don't have that protection, what you find is that you get higher callback rates in the cities with the protection, right? So even just the general vibe of the city and the presence of those laws in place makes a difference in terms of how people are actually being treated, right? And in other work that's similar, if you take a law that people don't really know about, so you can kind of screen people that they're not aware of whether there's a law, but if you tell them there's a law or there's not, then they treat applicants differently as well. So it's just, again, like having the law in place that protects against discrimination in the Caribbean, like in Amin's case, or decriminalization of sex work. Both of those things matter. It's the presence or absence of laws really change and impact the way that people treat people, right?
Thank you for that response. And this question is for Amin, just to piggyback on what Dr. Martinez was talking about earlier, is that the laws, social stigma and violence against LGBTQ plus people in the Caribbean affect their workplace experiences. Could you tell us a little bit more? As a result of this, a number of individuals, they do not want to come out, they're unemployed, they have to seek alternate forms of employment. I believe sex work is illegal in the Caribbean still. So how has COVID-19 impacted the livelihood of members of this community, particularly those engaged in entrepreneurship?
Right. So like everywhere else in the world, COVID flatlined a lot of economic sectors. In the Caribbean, because we're so reliant on tourism, that was one of the main sectors that was impacted negatively. We saw total shutdowns of every hotel and other sectors, taxi, attraction sites. Quite a few people in the region are employed within the hotel sector, within the tourism sector, because for some reason that sector tends to feed and encourage your personality. So people can be themselves working within that, because a lot of outside people love that type of behavior. What we saw was that a lot of people, especially members of the community, leaning into talents and skills. If you could bake, if you could cook, if you could sew, people were then leaning into that and using their network of friends, using our tribe to say, hey, I know somebody who can do this. And that way the money began to flow because community members were supporting other community members. There was an American organization, I think it's Outright Action International, who provided funding to United and Strong, which is a human rights NGO in St. Lucia. And United and Strong in St. Lucia used those funds to provide care packages to the most deserving. But there is some resuscitation in the economy slowly. We're getting there, and quite a few people have started going back to work, especially within the tourism sector. But still, a lot of members in the community who are not as skilled or not as educated still rely on others within our little tribe for support.
Thank you, Amin. And just to continue along the line of work, Ms. Garcia, you spoke earlier about sex work, and we know that there are so many laws against sex work. What would you like the public to know about sex work, and how do you think we could work towards eradicating the stigma around sex work and people who do sex work? You're on mute.
I was on mute, sorry. So I do the fun sex work because I'm also a survivor of human trafficking, and I know one of the reasons why people doesn't support the decriminalization of sex work is because they are thinking about human trafficking survivors, which is fine because I'm also a survivor of human trafficking. But the thing is that it's that during when I was trafficked, I was afraid of going to the police or saying something to the police because I know that sex work is illegal. I know that many people that are being human trafficking are also people of color and undocumented people, and they are afraid of going to the police, and also because the police doesn't offer you language services for human trafficking. And I know that we have the vice squad, the vice unit It's there to protect sex workers or human trafficking survivors. But the thing is that they are not there to support them. And I remember the case of a Chinese woman that has to jump from the second floor in Flushing because she was escaping of the vice units. And that's how sex workers deal every day, day by day, with the police harassment. Because, as I told you, if you are a sex worker or if you are a transgender, the police assume that you are doing sex work, or they assume you're just there to do sex work. And we know that we have many abilities to do some other works, but the reality is that society doesn't give you the opportunity to do another job. And I know for sure that if we decriminalize sex work, that it's gonna open a door for those people that are being trafficked to feel more comfortable going to the police and say, this is what is happening to me, without afraid of being arrested or being la burla of those people. And I know for sure, because I know many people, when I was 18 and I started like taking hormones, and also I was, I started my transition with two other transgender people. They are no longer in this country because they were arrested and deported back to their country. And where's the protection there? Because we came from our countries escaping transphobia, and they deport us because we want to survive. I don't know. I'm just saying that if you ever do sex work to survive, at least you have to understand that there is people surviving doing sex work. And for sure, I know that many people that doesn't support sex work, they never in their life has to like sell their body to eat, to pay their bills. But we do, and we are here, raising up our voices, and also la lucha, and that it's important for our communities, for those that that doesn't have a job. Thank you.
Thank you. And speaking of, all of the issues and the challenges that transgender people face, as well as people from the community, this question is for Dr. Awad. What resources are available at Northwell to help members of that community?
Sure. So Northwell has a whole host of available resources, in the way of transgender care specifically. We have our LGBTQ transgender program here in New Hyde Park. That's where I work, providing primary care and hormone therapy. We also have the Freeman Center for Transgender Health in Manhattan. And we have for people living with HIV, have the Center for Young Adult, Adolescent, and Pediatric HIV Services, and their prevention services in Regal Park, as well as Jackson Heights through Project Inspect. So lots of resources there. Quick ways for anybody who may need information or connected with services can reach out through lgbthealth@northwell.edu or Center for Trans Care at northwell.edu. Those are both two ways to get in touch with all of those programs and to be connected with care. We have also, sorry, just one last thing I forgot. We have two trans health navigators who work in our practice here in New Hyde Park. They're incredibly passionate, hardworking individuals that are very familiar with the resources that are available here on Long Island through community partners, as well as within the healthcare system. Dee Colon, the coordinator at the Freeman Center in Manhattan, is also an incredible resource for the community as well. So all three of those individuals are very stellar resources.
Thank you. And still, to just piggyback on that, this question is for Dr. Martinez. You do a lot of research on allyship. So tell us how, like individuals like myself or heterosexual and want to become allies, what are the strategies that we could use when we see discrimination, or we want to educate people on sex work or whatever it is? Like, what strategies could we use?
Sure, that's a huge question, right? We do trainings on allyship. It takes several hours. Ideally, it would take several weeks, right, worth of training. But I think one of the most important principles with allyship is being what we're referring to as a consensual ally. We see a lot of times people kind of, especially when they're sort of navigating, like white guilt or like the realization that they have relative power in situations that other people don't have, and they feel responsible to wield that power in a way to help other people. A lot of times what we see is that then they overstep their bounds, right? And they insert themselves into places and spaces and conversations that they don't need to insert themselves in. And what that does sometimes is it kind of ironically legitimizes the power differential between the white person or the whoever it is, the majority relatively powerful person, who is more powerful, and then showing like, I'm going to save you, right? And I'm going to be the one that helps you. And it legitimizes these power differentials that they're ostensibly supposed to be dismantling, right? So to avoid that is to ask, what sort of support do you need? Not assuming that what we see a lot of times in organizations is organizational leaders that tend to be white and heterosexual, thinking like, okay, we need an employee resource group for our Black employees, or we need an employee resource group for our LGBT employees. And it's like, well, you should ask your employees if that's something that they want, and not just assume that that's something that they want, because they might want something else, right? And if you're gonna devote time and money and resources and space, do it in a way that they want it to be done, right? And then provide those things. Those are things that are important and necessary, but then kind of get out of the way and allow those people that have the energy to take on those initiatives to lead those initiatives. And the idea of energy is important too, because we have to recognize that BIPOC and LGBT folks, especially in organizations, get put on committees, they get put on mentoring activities, they get put on initiatives because of their identities, right? And they often don't get paid extra for doing that work. So you're kind of burdening people who are already overburdened in a way that they don't want to be burdened. And then if you're not asking them what they want to be done anyway, then it's even worse, right? So that's a big part, is just sort of like asking. It's okay to ask and do it in a conversational, sort of confrontational way. The other thing that I think is really important that we do a lot of research on is actually confronting prejudice, right? So prejudice isn't something that happens every day, but people are pretty good at understanding when something is wrong, when somebody says something incorrectly, when somebody says something that can be harmful to others. And there are a lot of cognitive barriers that sort of get in the way of people actually saying like, hey, you shouldn't say that. That's not the norm around here. I didn't think you were that way, like calling it out and addressing it and sort of dispelling the notion that that type of language and that behavior is okay, right? Because that's the assumption when people aren't confronted. It's like, oh, I guess people can talk that way here. And it creates a climate and a culture in the organization that is toxic. And that climate and culture is also one of the best predictors of those forms of incivility actually perpetuating. So you get these spirals, right? So it's like, if you just have a language, a vernacular, a protocol, a policy, a practice that's not emotionally laden, right? And it's like you think about, we do work also in like organizational safety, right? So if somebody trips and falls, there's a form, there's a practice, there's a policy. This is how we handle it. It's not a big deal. And when somebody like proverbially trips and falls, or they say something that is hurtful or harmful, which is going to happen every now and then, there should be a policy and a protocol in place for addressing that and making sure that the norm is upheld, right? So I think it's just sort of addressing the fact that not everybody's going to be perfect all the time, and taking the initiative as an organization and as an organizational leader to do the work, have the uncomfortable conversations that are especially uncomfortable recently, right? But they're so important because that's the case.
Thank you. And just to piggyback off that, this question is for Mr. Flood. If you were to talk to your younger self or any young person now watching you and who wants to come out and live the best self, like you said that, you know, traveling the world on the cruise ship allowed you to live your best self and be who you truly are, what advice would you give to these individuals?
Right. Well, if I could give advice to, my coming out story is unique in that I was supported by everybody in my family, both my mom and dad, my brothers and sisters, extended family. Everybody was extremely supportive because they saw certain behavior traits in me as a child that only confirmed to them when I came out. My advice to any young person, especially in the Caribbean, is don't rush to come out. Know the culture of your country, know the culture of your family. If you will be supported in that environment, then by all means, live your best life. But if in most Caribbean islands, we know your life literally depends on you staying in the closet. If that is the case, stay there. If it is toxic and you need to leave, you cannot be who you are, you find ways to get out, whether it's through work, whether it's through school, whether it's through refugee applications, because there are organizations that can assist you in that. A thing I see with the younger generation, especially in the Instagram and social media era in the Caribbean, is these kids are living a life and they miss the most important thing, I think, for me, which is self-respect. And growing up, you know, when I came out to my dad, he shared something with me that really made me appreciate the family that I had. And in essence, self-respect leads to self-preservation. So just be willing to accept your reality, know your boundaries. Don't let people define your boundaries as well. That's the advice I would give to anybody. Mainly know the culture of your country, know the culture of your family, and decide what is best for you.
Thank you. And Ms. Garcia, along those lines as well, how would you say that people can get involved in LGBTQ plus advocacy?
I think one of the it will be having more conversations like this. Also, like, you know, attending support groups to, where you can learn about transgender experiences, supporting events. As Dr. Mayers mentioned, I'm the organizer of the largest march in Jackson Heights called the Trans Latinx March. We started with a dream of, you know, to demand our rights in Jackson Heights. The first year we mobilized 50 people, like, you know, 50 people march in that march. But last year, before COVID-19, we mobilized more than 600 people, and it's amazing. That's when that's how you can support our transgender people. Also, if you know someone that is trans, ask them every day, or maybe when you have the time, how are you? How you feel? Because sometimes we are also smiling, but you don't know how we feel from inside. Because being trans, it's so hard. It's very difficult from seeing people, like, you know, when you're walking down the street and they just look at you. They doesn't say nothing to you, but you know, you feel that. Yeah, just attending to support groups or talking to your people, and that's how you can help us. Thank you.
Thank you. And I know another way that individuals can help, or the health systems can help, is through the use of PrEP. So Dr. Awad, can you tell us a little bit about PrEP and how we could make it more widely available to the community that needs it the most?
Sure, definitely. I think so. Just to start off with a brief definition of PrEP, it's pre-exposure prophylaxis, right? So it's one pill once a day for people who are at risk of HIV infection. You know, in New York State, thankfully, there is good coverage. Even those who are uninsured are able to apply through, you know, through New York State for something called PrEP app, and that will cover the costs associated with medical visits, labs, and such to maintain on the medication. But the application process, you know, does require some amount of assistance. So it's important, you know, for health systems and organizations to do outreach work to connect with patients who would benefit from the intervention and help them to get the coverage that they need to cover the medication. The producers of the medication have patient assistance programs, and there is a large amount available at no cost to patients, but knowing how to access it is a very different story. So, you know, just like we talked about with other issues in healthcare, access, you know, language barrier, knowing how to discuss things and education. There's a lot of education that needs to be done. So you see PrEP uptake being much higher in like the white men who have sex with men community than any of the communities of color, and specifically the trans communities and trans communities of color. So I think, you know, getting the information out and then building trust with patients to have them come in to take this, you know, life-saving intervention. I think, you know, similar to what Dr. Martinez mentioned earlier, you know, unfortunately, PrEP has somewhat been viewed as like this miracle that will sort of solve all things. And you know, I was at a conference once, and someone from the actual drug companies stood up and asked the community, you know, what could we do better to support you, and what can we do, and you know, we want to make sure that you're able to get PrEP, and this and that and the other. And I think that it was maybe coming from a good place, I'd like to believe, but someone from the community stood up and said, I don't want your PrEP. I don't care about PrEP. I'm worried about where my next meal is going to come from. I'm worried about where I'm going to sleep tonight. I'm worried about getting murdered in the street. These are the things I'm worried about. So just having an awareness of your audience and sort of what their needs are and how you could actually be of utility to them. And, you know, this particular lady who stood up and spoke said, if I got HIV, it would be easier for me to get an apartment. And that really, the room, just like you could just feel the whole room, like a chill go down everyone's spine, because everybody was like, oh my gosh, we are so out of touch. We have no idea what we're up against and how we can actually make ourselves useful. So for us, you know, there's a tendency, especially in the healthcare industry, to really focus on what we want for a patient, what we would prescribe for a patient, and how we think that they should be treated, instead of really providing patient-centered care, meeting patients where they are, and helping them to really thrive, because what might be the most important thing to them, it could be very different than what we would assume as the most important thing when they come in for care. So really, I think that is quite possibly the biggest barrier to engage in this community and effectively and using these life-saving interventions to keep people safe and bring down those rates.
Thank you so much for this. And that brings me to a very interesting question now that you're talking about like patient needs and making things patient-centered. We too can make things employee-centered, and we hear so much talk about the Great Resignation. So this question is for Dr. Martinez, where it has so much about the Great Resignation and individuals are just leaving their jobs. And I don't think it's just like at the spur of the moment that individuals are just like, all right, peace, I'm out. But we could see that a majority of the people who are leaving tend to be, you know, minority people, people with minoritized identities. So can you tell us a little bit more about the Great Resignation and what employers can do to meet the needs of minority employees during this time?
Yeah, I think we're really early, right? It's hard to, we can theorize and think about what might be happening, but I would feel more comfortable if we had a little more time and a little bit more data. What I am actually haunted by a little bit is the statistic that you mentioned earlier about the discrepancy in life expectancy between cisgender and transgender Black women. And I think in addition to all the things that Dr. Awad said, I think it's important to also name discrimination as a potential risk, right? So in psychology, we have what's called the minority stress hypothesis. And it's basically this idea that dealing with chronic daily instances of discrimination, like what Biane and Amin have talked about, and many of us have experienced, those are the things that are related to heart disease and stroke and the main indicators of poor health and of death in this country. So if you think about like acute stress, if your house burns down, that's very stressful, but then that stress level sort of like, it recalibrates, right? But chronic stress is different. Chronic stress is the daily sort of stuff, and discrimination as characterized as chronic stress leads to these negative health outcomes and leads to these main killers of people in the US. So I think naming that and understanding that, okay, sure, it may not be that you're physically being harmed every day, but psychological harm is also really, really, really a huge factor in this. So just, I wanted to sort of talk about that a little bit as well.
Well, thank you everybody for a wonderful show. We had a wonderful panel of esteemed guests, including Amin Flood. We also had Ms. Biani Garcia, as well as Dr. Christopher Awad and Dr. Larry Martinez, who all focused on so many wonderful topics in regards to this poignant conversation about the LGBT community. I think there were a lot of food thought that was here and a lot of points that we need to address, including the fact that transgender discrimination for women, especially of women of color, can be pretty severe. Whether it's in the workplace, on the street. You know, unfortunately, Mrs. Garcia told us a very unfortunate story about when she was walking with her partner, and because she had condoms, police assumed that she was doing sex work, totally not legitimizing the fact that she was in a relationship and she was with her partner, but instead assumed that she was doing sex work just because she was transgendered, which is totally appalling. And I'm really sorry that you had to go through that. And in 2021, we should not be living this way in this country or any country in the world. And, you know, this whole conversation at the end that Dr. Awad brought up, as well as Ms. Garcia, reminds me of one time I watched the Caitlyn Jenner transgender show. And those transgendered women gave it to Caitlyn and said, look, you are a privileged white woman. You do not know what we've had to do for sex work. And I was just like rooting for them at the table because I really felt their pain. Like, you have all this money, you have all this exposure, so you can get your multiple surgeries. You can do all these things and you will be fine, because at the end of the day, people knew you as Bruce Jenner most of your life. Whereas a lot of the transgender women at the table, or like with Ms. Garcia, have been living in about this life since they were young. So it's a much different experience when you spent 50, 60 years as a cisgendered man living as a heterosexual, as a part of the dominant culture, as opposed to being someone who's not a part of the dominant culture, who's lived their true life. And unfortunately, and we're fortunate enough not to have to stay in the closet, as Mr. Flood talked about earlier, and have lived and tried to do advocacy work for the transgender or the other parts of the LGBTQ community. We also know that there has been issues with access to healthcare. I know for someone that lives in the outer boroughs, there usually was not much access to transgender care. Very often it was limited to Manhattan, but thanks to some of the expansion that we've seen at Northwell, with some of the places that Dr. Awad mentioned, also Staten Island, I know they also have a transgender center out there as well. And also we know out in Long Island, some of the people in my practice have been working with your clinic over there on Lakeville Road to expand access to care and provide hormonal support. And we do see people in our office who are getting hormonal therapy, whether they're transgender male to female or female to male. And I can say in our office that our staff has been trained so that when people call, we are supposed to ask pertinent questions so that people can be addressed appropriately, because pronouns matter. The same way I want to be called she and her, somebody else may want that same title, or some people don't want to be called any pronoun. So we should respect all people's preferences for their gender as well as their sexual orientation. We also need to be allies. In allyship, you have to stand up. Dr. Martinez really saliently talked about consensual allyship, and I was actually watching something on allyship today. And there are definitely different variables in terms of when you think of ally, because there's some people that just will stand around and do nothing. They'll be like, yes, I'll put my LGBT flag up in my yard, but what are they doing? And the same thing happens with Black Lives Matter. We'll put the sign up in the yard, but what are you doing to speak up for the trans females that are being killed at higher rates when they're Black and Hispanic? What are you doing? Are you speaking up? Are you saying anything? Are you providing education like Ms. Garcia mentioned? And then also back to the workplace, like Dr. Martinez mentioned, in the workplace, discrimination is very high, and it's important that we work with HR to ensure that people in the LGBTQ community are getting fair treatment. And we know that there's gender inequality, we know there's race inequality, but there's also sexual orientation inequality that should be addressed as well. And I think one of the saddest things that we talked about today was the whole process of coming out. I mean, Mr. Flood, your story, you're very lucky, but most people I know that come from other places, and even people here in the US, are staying in the closet because they don't have a family. I have a family member we all know, but because of the whole Caribbean background, he's not coming out. And, you know, he's from that older generation, so I already understand why. But, you know, it's unfortunate that so many people don't have the luxury that you have, that you can come out and tell your story and speak your truth. And a lot of people are unfortunately living in the shadows. So support is definite. And I actually had a friend who I met on study abroad who came here as a refugee because in his country in Africa, he could not live as an openly gay man. So it is true that you can, if you're lucky, come here, but of course that's not for everybody. Everyone doesn't have that luck, and some people unfortunately have a much harder journey like Ms. Garcia shared with us. And last but not least, just want to talk about PrEP, that is pre-exposure prophylaxis. I know a lot of gay men who use it, but the transgender community, you guys got to get using it just the same, because the rates of HIV are really high. So it's important that you get access to PrEP. And as Dr. Awad mentioned, there's a lot of patient assistance programs out there. New York City, we're very progressive, but unfortunately for people that live upstate or in other states, they may not have that same access. There are actually websites where you can go to find doctors who are versed in LGBTQ medicine. Dr. Awad is one of several that we have at Northwell. So if you feel that you need better care, please reach out. We have a whole listing of people who are LGBTQ champions and versed in LGBTQ health, because like Dr. Awad said, you should not have to tell your doctor what you need to be screened for and talk about your health. So with that, I just want to say thank you again. And I just want to plug our next show, which will be in 2 weeks, in which we will be talking about something that's near and dear to me, and that's the topic of diabetes. And we will have these wonderful guests on, NP Dessa Awajaji, who's from NYU Langone Health. Part of Sharon Zaninga, who's a nurse, a diabetes specialist, and she also has been living with type 1 diabetes. And last but not least, we have Jarrell Hicks, who's a certified personal trainer, also CEO of Fit to the Core, and we're going to be talking about living with diabetes during COVID. On behalf of Dr. Williams and myself, we thank you for joining us and have a wonderful night. And thank you to our esteemed panel. We greatly appreciate all 4 of you. Have a great night.
Thank you, everyone. Have a wonderful evening.